friends, welcome to Smile Nursing tutorial. As per the subscribers and views wanted phototherapy according to their wish, today I am going to speak about phototherapy. Very briefly we will discuss today. Phototherapy is the use of fluorescent light for breakdown of the bilirubin. Phototherapy acts by photo-oxidizing tissue bilirubin and changing yellow lipid bilirubin into colorless. So, non-toxic water-soluble bilirubin which can be easily excreted in the urine and bile. The length of time the neonate needs phototherapy depends on the level of serum bilirubin and clinical condition of the neonate. Thank you for watching this video.